on talk about how to diagnose neck pain, neck pain symptoms, right? Then what type of neck pain is that? What can you do at home for neck pain? How do you ease neck pain? By using acupressure point. And what else, right? Apart from acupressure point, what else can you do, right? Then we also need to talk about the strategy of acupuncture if you're a practitioner. So we're going to talk about what can you do, what strategy, what point can you use for neck pain, right? So we're going to step by step and go further to introduce to everyone. Oh, that's my Facebook, it's a problem. Let's start it over again. Facebook, my clinic page is not working at the moment on Facebook. Let me reset it again. Now, comment down there if you have neck pain, even your practitioner, and a lot of people have neck pain, including myself. I have neck pain. When I was in uni, the first episode actually happened in the last year of my high school. We studied very, very hard, and sitting in front of the table and reading and just doing this, and there was the worst experience ever. The reason I say that is because I have the neck pain first time that I felt I couldn't move my head. I didn't have neck pain before, and it was the first time that it actually hit me. And how I treated, I didn't go to any practitioner. My mom treated for myself, for me. My mom treated. It was awesome. So, and how did my mom treat it? Simple. We're using scraping technique. Mom just do guasa on me and it fix it. So this technique is easy. Then I would like to share with you when it comes to what can you do for yourself at home. So this is going to be a life changer. Why do I say that? Because all these things are very, very simple, but a lot of people didn't know that they can do that. It's very, very simple. Right. Let's have a look. All my platform go on now. So can you guys see me? Hi Veronica, nice to meet you. Video frozen. Is it still frozen? You're my student. Hi, happy day. Good morning, friend. Have a patient with severe neck pain. Okay. Now, okay, is the video still frozen or not? Because I can't see myself in here. Let me know if the video is still frozen. I think part of the issue is because I'm using one device and on a few crossover with a few platform. I think that's one of the issues. Is the internet slow? Anyway, I'm gonna start if everyone's okay with that. Okay, let me know if the video is still frozen. Okay, or should I start it again on Facebook? Can you guys still see me, Veronica? Should I do this? Should I kill it and then start it again? Can you guys see me? I'm trying setting. What happened? Seems okay in here. On and off. Okay, that's not good. On and off. Let's start it again. Now, forgive me if the other platform, if you're waiting for this, I'm trying to set up a Facebook page for practitioner. Okay, let's set it up. Okay, the video. What's the topic? What's the topic? Video. Seems okay with me. Yeah, I was running. Yeah, seems okay right now. Waiting for you to come out. Okay, if you're on this live, please say hello to me. Give me a thumbs up, and if you're on Facebook, please tag your friends on this live video. We're gonna talk about what is neck pain. What is neck pain today? This is topic. Okay, I think it's going good now. Then, apart talking about what is neck pain, further on tomorrow, the next day, we'll talk about all neck pain and talk about symptoms of neck pain, what caused neck pain, and what can you do at home for neck pain, self-treatment, and we're going to talk about as a practitioner, what can you do for a patient, what strategy have you got, all those things. Now, if you suffer from neck pain, please let me know down there. Comment down there that you have neck pain and describe. Let me know how you feel about your neck pain. How bad is your neck pain? Okay. So first, we need to know about the structure of the neck, right? Yes. Here you go. What is this? This is vertebrae. Okay. So neck is actually made up of vertebrae. Yeah. So this vertebrae, this is called vertebrae. The white part. Okay. The white here is cervical. The blue here is your chest, we call thoracic. The green here is lumbar, right? But of course, in your body, it's all white, right? The real one. They put it in different color. It's just letting you know. A different part will give a different name. Okay. Well, to be honest, the vertebrae are all pretty similar. The function of them pretty similar. And because on a different part, we name it different. We name it differently. Okay. We name it differently. Now, this is vertebrae, and you can see some white part over here. And between them, they have some white part over there. This between them, what we call them is called disc, cervical disc. Okay. Why cervical disc between two vertebrae? Because when you stand up or you jump, and the vertebrae can compress themselves. When it compress or when you move, the neck move. Unfortunately, this model is not going to move. Oh, I just break it. Yeah. Oh, I can take it apart. Okay. Yeah, better not take it. Yeah. So it's important that the disc. Oh, Seems like broken. This one. Okay. So it's the cushion, and it's firm, and it's always in there. It's like cushion, you know. So it's one cushion in between two vertebrae. So when two vertebrae compress together, they compress on the uh, um, disc, okay, and the disc can absorb the force uh, of the compression, okay. So it actually protect the vertebrae against each other or damage, you know. If both hard thing gonna knock together, you know, and then if they do this, you know, that's gonna hurt. That's gonna damage one day, you know. So you need the disc in between, so you can't it can't compress it. Okay, so the disc is very important. So it plays on between vertebrae, which is bone. Okay, vertebrae is bone. This is all bone. Okay, but the disc is not bone. So what else do we have in here? We have nerve. You can see here, and you have ligament, which doesn't show in here, and muscle. Okay, so muscle contraction help your neck to turn. Your neck movement can be going to the sideway to side, as you see me, and up and down, backward, forward. Okay, what else? Your ear goes sideways. Okay, this are basically the neck um, motion. Okay, your head going. Okay, so your neck is actually supporting the bone, ligament, and muscles. Okay, they support your head, allow your head stay on the top of your body, entire body. Okay, now the movement and there is how we normally uh, examine patient. You know, so if patient have neck pain come to you, so they may be able to turn that way, no problem. But when they turn to here, it's painful in here. But when they turn that way, they get pain. It doesn't mean that the pain is always on that side. Right? It can be in here. When they turn that, I got pain in here. When they turn here, I got pain in here. It can be both sides. It can be one or the other. Same as here, forward and backward. It can be in the middle of the pain. The pain can be in the middle, or it can be on the side, either side, or both sides. You know, or they can't move at all. The first neck pain I had, I still remember that was in my high school, and I couldn't move my head. I couldn't move this. I couldn't move this. I couldn't move. I guess I had to stay in one position. In one position, you know. This for a few days. I had pain for a few days. I can sleep. I do, and the whole day I do. When I turn, I have to do this. You know, that's horrible experience. And my mom fixed it for me. I'm gonna share with you when it comes to how to ease your neck pain at home. And it's very, very simple, and it's very traditional Chinese way to fix the neck pain. And it works. Guess what? It works, you know? Okay. Now when your neck, what causing the pain actually, what can cause an injury? You know, a sport can do that, you know, car accident, any accident, sleeping in a bad position, a position that give you a neck problem, you know. Uh, in Chinese we call 落枕, which is pillow neck pain, because you're not placing your pillow properly while you sleep and you get the pain. Inflammation, you know, so inflammation in the joint, so causing the problem. That can be okay. It can be high blood pressure that causing the problem. It can be bone cancer that causing the problem, you know, a lot of reasons. But we'll talk about the what cause neck pain. And neck pain can also trigger the headache. Okay, and the trigger. So neck pain can trigger headache, and what can trigger neck pain? Your diet, poor diet can trigger neck pain. What else? Stress, depression. When people are stressed and they can trigger the neck pain. What else? Cold. When the cold weather comes, it can trigger the neck pain as well. So work out what trigger the neck pain is important, because therefore you can manage the trigger. Once you manage the trigger factor, you can avoid neck pain, right? But the root of the neck pain, which is the bone, muscle, tendon, joint, all the structure things, what are controlling them? The organs controlling them. So what the organ is important. I just have a practitioner contact me. He's in Canada. Was it in, not Vancouver? Yeah, I don't know what city. I've never been to Canada. And he told me that he watched my video and he loved it. He said in his practice, he treat patient and go through with patient using global balance a lot. Obviously, he learns he learned what do you call it? Balance method acupuncture as well. Okay, so what happened is he told me that when he treat patient, he always look at the full body to check the organs. No matter, just we know acupuncture is great for pain, but acupuncture with practitioner miss out a lot of things. What are they missing out? When neck pain comes, they just treat the neck. Of course, you get the neck pain shorter, but it may take long time. It may just a few treatment, there's no pain at all. But what we forget about things, we miss out about things is this neck pain. How does it happen? If you look at the neck pain as injury, it's actually not injury can be a trigger factor. It's not the real reason. Why do I say that? And why people sleep in one position and get up, they have neck pain. That is due to because of the weakness of the not enough strength of the muscle of the neck that causing the problem. Because some people sleep and every week they get neck pain. It happen every week. I used to happen every week. Yes. Honestly, I used to happen very often, weekly neck pain. Got better, bang again, bang again. Yes, sleep position is important, but now I sleep on a funny position, I don't get neck pain. Why is that? That's because I look after my organs. Now, if you have a patient, they come to you every week or very often to treat neck pain, and you treat them very good, instant relief, and pain gone. And after a few days, after a week or two, come back again, I have neck pain again, I sleep in a funny position. And that happened again and again and again. That I will tell you, your strategy needs to change. What strategy you need to change? You need to change the strategy to treat the organ rather than neck pain. Right? And this is important. This is what Chinese medicine is. Okay. So for other other field with practitioner, the doctor, GP just give you pill, or send you to physiotherapy. And physiotherapy, they look at the structure. I'm not saying they are wrong or they are bad or things like that. They look at your structure. It is right to look at the structure, okay? I look at the structure too. But as a Chinese medicine herbalist and acupuncturist, you need to understand the structure, who controls the structure. All the string come from the organs. Therefore, you need to go and check the organs. If they are organs imbalance, in this case, you need to treat the organs. The organs, bring the organ function better, improve the organ's function. Then you find this neck pain will get reduced and reduced and reduced. Eventually, no pain. Then it stayed that way. It stayed that way. Okay. Then of course, you need to manage all the stress factor and a lot of things. To treat the organ. If you find any case of you, it doesn't last well. The result doesn't last well. It keeps coming back. Then remember, treat the organ. Okay. Now you want to tell me, how do I treat the organ? I've shown you already. Magical 12, Magical 8 for the practitioner. I show you already. 3, 1, 2, or rub your ear as a patient. I'll show you already. All those things. When I come to any kind of disease, I will talk about the organs imbalance. Then the same strategy, common strategy for everyone, rubbing the ear every day. I do it myself. Every day. I have video that show you how to rub the ear, how to massage the ear every day, right? And I show you 3 to 1 exercise, acupressure exercise, legs exercise, breathing exercise. Those are important. That's very important, right? So practitioner, you can do it yourself at home, okay? And you can suggest your patient to do it at home, apart from your acupuncture and Chinese herbs, okay? Anderson saying, good afternoon from Venezuela. Okay, neck pain is an important subject here. Thanks for sharing your knowledge. Thank you for supporting. Hi, America. By Hui 8 and by Hui 12, yes. Good strategy. Ali, hi Ali, how are you? I'm from Iraq. Wow, great. A friend from Iraq too, in New Zealand. Yeah, good. Thank you for joining us. Please give me a thumbs up and share this video and tag your friend into this live video. If you're on Facebook, Facebook can tag your friend, okay? Right, this is something about what's neck pain. Okay, we talk about treatment strategy things, the idea of it. So it's important to know the strategy, rather than the points, because you are in. If you just trying to use the acupressure point or acupuncture point, you always ask what point is the best for this disease, what point is the best for this disease. I will tell you, all the patients different. And if you're just looking for the points, you're not looking for the concept, the strategy, because I more value the strategy rather than point, because you may run out of points. But you never run out of strategy. Okay, with the strategy, with the theory in there, and this strategy, you change the strategy often if it's not working. And I change the strategy just about every day. Same strategy of 12. No, I don't change the strategy. Sorry, my bad. Like if I use 12 magical points, but I change the point. 12 meridian, magical 12, but I change the point regularly. Why is that? Because I use the pulse to check the organs. So each time the patient comes in, I check the pulse, and according to the diagnosis of the pulse, and I change the point regularly, just about every time. If the pose change, I change the point, but still needle the 12th meridian. No change. Everyone's working on 12th meridian, but which point do you choose? You know, what do you base on to change the point? You know, so the point can change every time, and especially when this doesn't work, you know, it can change every time. Okay, so many people experience neck pain. Okay, neck pain is not just neck pain. It can be stiffness. It can be tightness. You know, so when we call neck pain, are they just feeling the pain? And what type of pain? What kind of pain is it? It can be sharp. It can be dull. You know, it can come with a tingling numbness down to the hands and tingling numbness up to the head, and even go to the eyes. And it can make your eyes blurry too. You know, you can't see properly. I have this patient, they have neck pain. Yesterday, the patient said that the neck pain and shoulder pain from here straight away to what? They show you the line of what? Bladder meridian, and say up to the here and go to the eyes. And that's just proof that the meridian is there, and the patient straight away tell you, and you can see, oh, it's amazing. They can tell. They don't know what meridian is. They don't know bladder meridians, but they can show you the bladder meridian. The pain come from here and go and come to my eyes. See, make my eyes blurry. You see, this is what if I'm sure you have some patients tell you this as well. I've seen quite a lot of patients have this pain straight away up to the neck and go to the eyes. And the eyes very uncomfortable. Okay, very uncomfortable. So in many cases, the neck pain actually due to poor posture or overuse. Yeah, it is structural issues, you know. But even though it comes to poor posture, I always ask my patient why I can sit like this, and you have to sit like this. You know, they have to sit like this, and they try to put the cell up, but they haven't got the strength. Why can't they have the strength? Yes, people get support. It help. It definitely help using support. But support, the extra support, it'll help your neck. But you need to learn. You need to retrain your muscle. Training is important. Exercise training your muscle up is important. But some people they can't do training. They can't do exercise. It make it worse. So no matter what, always check the organs. That is my strategy. Always go to the organs and find out if there is any organs imbalance. Treat the organs imbalance as well as the neck pain. Then you will find that this strategy works for everyone. They're always right. You're always on the right track if you treat the organ. Check the organ. If there is any problem in the organ, treat the organ. The postural problem, get the support and teach them how to sit properly. That's still important. Okay, I'm not saying if you treat the organs you can forget the others. No, you need to do massage. If you benefit from massage, do massage. If you benefit from heat pack, do big heat pack. Benefit from sleeping on the right position, teach them how to sleep on the right position. And benefit from sitting properly, teach them how to show them how to sit properly. This all important, okay? But I want to point out thing is most people, of course for patients, they don't know about organ function, right? But most acupuncture and Chinese practitioners, they didn't think of the organ function, right? Now, of course, physiotherapy, chiropractor, osteopath, they don't have this idea. They look at the structure. Then we can't tell them off because that is what it is. They are doing their things, you know, in their field, in their theory. And the theory, they look at the structure. There's nothing wrong. But we, Chinese medicine, acupuncturists, when we look at their structure, you know, you should look at the structure when you treat neck pain. You know, anything come in, you know, I always look at the structures first, as well as organs, organ function. Okay, this is all important. I need to point it out again and again for you to put in your mind, so you know you want to look at the structure and organ function when it comes to neck pain. Does it make sense to you? I hope that makes sense to you. Now, let me know when you treat neck pain, what is the strategy? What is the strategy? Are you just looking for the point? What is the best point for acupuncture for neck pain? Or you're looking for balancing the neck pain? Are you looking for posture issues, structure issues? You know, do you take picture for your patient and look at the neck, look at the whole body structure? When you look at the structure, you don't just look at the neck structure, you look at the whole back, even the leg. This is G acupuncture. I take picture for whole body, and I can see that if they have spine problem, the neck problem can be from the hips, pelvic, lower back. You know, it can be from that too. But when it comes to balanced method acupuncture, it doesn't care about this. Now I teach balanced method acupuncture. Yes, we can use balanced method acupuncture to treat neck pain and the organs function, but there's something missing out. That structure, because the problem and make harm from the hips or the leg imbalance. The leg imbalance. Now you need to treat the structure of the leg imbalance or the pelvic imbalance or lower back imbalance, and therefore this will be stable. I'm not saying that when you use balanced method acupuncture, you can't treat it. Yes, you can. In some cases, you can still relieve the neck pain, but when you realize there's a structure change in the bottom part, you balance the legs or the pelvic or the lower back or the spine, and you find this, it went away quickly and stay stable. And this is another idea for you when it comes to structure. Okay, very, very important. That's about G acupuncture. And I check in our first treatment, we call first initial examination. So examine my patient and also the part structure, organ function, meridian blockage, and explain to patient, you know, and find out the factor and everything. Ask also the question, a lot of things, take the pulse, see the tongue, you know. You need to have a full body checkup according to Chinese medicines. Okay, if they have an X-ray, MRI, you know, you want to look at it. You know, I'm not an expert to look at it, but we learned that in a university. But now a lot of people just study acupuncture, and you don't actually have the idea of how important is that. But because I study Chinese medicine and Western medicine, so I know how important is that. Okay, so you need that. Okay, if you don't know how to look at it, you know, it's fine. Just read the X-ray or MRI report and look at what the expert actually tell you what it is. Okay, again, I'm not an expert to read X-ray or MRI or CT scan, but I know I have some idea, because when we were in hospital, we have to learn all this in China. Yeah. Okay. Right. So most of the time, neck pain isn't a serious condition, and it can be relieved within a few days. Okay. Yeah. Most of the time, you know, it can be relieved even though you don't treat it, because a human body is powerful and amazing. It can heal itself. It can heal itself. Our body can heal ourselves, you know, and it's just what everyone experience. You have some pain, but then after a few days, it's gone, because your body heals itself. Because your organs are still strong, it can heal itself. But in some cases, your neck pain can indicate serious injury or illness. Okay, and it actually requires require a doctor, a practitioner, an acupuncturist, chiropractor, you know, a surgeon to look at it. So what else? The structural problem. Mainly, and we talk about doctor, is a structural problem. Okay, if they had to do the X-ray, MRI, you know, or CT scan to look at everything. If everything's fine, then they can't find anything when it comes to neck pain with the Western doctor. All the X-ray, because they rely on this to diagnose the serious problem. If everything comes fine, no problem, then who can help with that? Acupuncture, because we treat the organs. Okay, because we treat the organ, and we not just treat the organ, we have a way to release the pain as well. Okay. Now, if you have neck pain that continue and more than a week, if you're patient, if you're patient of neck pain, if you have someone that around you that suffer from neck pain, and the neck pain is not going away, it stay there more than a week, or quite severe, and affect your work. You can't work, you can't function properly, and it might cause you neck pain. It gave you tingling hands or tingling in the face, and you can't sleep. Affect your sleep, keep waking you up, no comfortable position. Okay, you need to see a doctor or a practitioner immediately, because it can be serious. Now, with the neck pain that stop you or preventing you to do something that you love or you like, or you work, you know, in your life, affect your life, then you need to see someone. You really need to see someone, get help. Okay, of course, in here, acupuncture is the best because we have a different idea. You know, we look at the Western doctors' idea, and we look at the Eastern as well. That's me. Okay. This is the idea of, oh, you guys put more in here, comment more in here. I want, Ali said, I want some information about true scalp acupuncture. Can you help me, please? I know you can. You have no. True scalp acupuncture, what do you want to know? I'm not legally, allowed to teach true scalp acupuncture, but I can share. I'm happy to share information. Yes, definitely. Again, if you want to know the about the true scalp acupuncture point, the area, okay, I use very differently because I have different map of acupuncture, and I don't think that you have to go exactly. And I've shown on my video previously. I think I post someone write down to exactly where it is, and I repost it on our group, our group. I think a group on our page as well, and you can check the post. I would suggest you go to Dr. Chu's website and bought his book. All these things in his book, So to respect Dr. Chu, get his book, then all the answers in there. Okay, and you won't. If I say it wrong and someone mentioned it wrong, and you're gonna follow it wrong, you're gonna get to the wrong image. So get the book, the first thing, because this is the knowledge of Dr. Chu, and he. So we respect him. So I suggest you buy his book. Simple. And I know a lot of you try to get things for free, and this is the wrong mindset. Okay, when you get things, you pay for it. When you pay for it, you value it. When you value it, you learn it, and that is the great energy, and it help you improve your skill, right? Some people when I asked them, hey, go to Dr. Zhu's website and get the book, and they keep bugging me for Dr. Zhu's scalp acupuncture, and they weren't happy about it because I don't give the direct answer. As I say, if things that I can give you direct answer, like balance method acupuncture, I will be able to do this. But Zhu scalp acupuncture, Dr. Zhu still there. He's teaching. He's got book, and he's not assigning me to say that, hey, Szenan, you can share everything of my stuff, my knowledge. No, he didn't say that. But I can share a general stuff, information for you to encourage you to go deeper for Dr. Zhu stuff. Okay, if you want to do that, go for it. Right. So don't bugging me if I don't share with you with Dr. Zhu stuff. Okay, I say the best thing is go and get his book, right, and do some Google search, right. So something that I can allow to share with you, something I don't allow to share with you because I respect Dr. Zhu. I hope you understand that. Happy Day say, very interesting topic. How can one check the imbalanced organ? The imbalanced organ is all based on a good question, based on what do you learn from your school. This is all basic stuff, you know. I'm not here to teach you this. If you want me to do this, it take more time. Okay. For example, spleen and stomach problem, diarrhea, constipation, stomach pain, bloating, nausea. This is from, you know, in Chinese medicine, we take the pulse, we see the tongue, you know, you ask the question, what I just mentioned, all this, you can simply ask the question to indicate what organs are out of balance. If the patient have diagnosed bloating all the time, if fatigue, you want to treat this, you want to treat the spleen and stomach to reduce all the symptoms, the internal organs problem. This is how you check the imbalanced organ. This is just one of them. So diarrhea and constipation, it's not just stomach and spleen problem. It can be small intestine and large intestine, right? Then if you don't know how to tell which organs, treat them all. Treat them all. And there's nothing wrong with that. Okay, this is important. So will you talk one day about heart-shaped headache? Yes, we will do that. My plan is going for neck pain first, and I will come back to headache. Because we talk about migraine, right? Last topic. That I don't want to go to headaches. It's too boring. We all talk about headache, you know. So back to neck pain first, because neck pain actually associated with headache and migraine as well. So we talk about migraine, come to neck pain, migraine, neck pain, come back to headache. And all the headache, we can talk about a lot of different type of headache, tension headache, all these things. Okay. Need to see how you take photo for GE acupuncture. Agree totally. Education one has to pay. Thank you. Yes. I learn all my stuff. This is how I learn. Okay. I pay for it. Okay. I'm still paying for someone to learn the skill. Okay. Thank you, Szenan. Appreciate your gift of knowledge. Thank you for America, for your support. But I do agree with you guys to learn yourself first. Get anything that's on hand online that you know you can grab, anything you can grab. It's for free, and learn it first. Self-learning is always the best way to learn things for the start. Okay, so this is what I do. I learn never acupuncture, balance method acupuncture, GE acupuncture, Zhu scalp acupuncture, post-diagnose acupuncture. I do the same. All this teacher master, they have a free classes to introduce the stuff, and they will give you the real thing, the real 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 things, a real theory in there, how they develop here this problem, the acupuncture technique, and they share with you. So when you read that, you attend to the free class. A lot of it online, so I don't have to go there. So I listen to it, I check online and get some information, and I think, okay, you have this theory. Where's the theory come from, and can I do it? Can I modify it before I go to your seminar and workshop? If I can modify it, which means this is easy to learn, right? Even without going to workshop, I can do your stuff. I'm not fully understand it, but I can apply the theory and copy, duplicate the results. If I can duplicate the skill and results, I got the result. That means this technique is easy to learn. Then I ask myself, do I need it? Yes, I need it. Can it improve my skill? Yes, it can. Can it help my patient even further with this technique? I tried it first. Yes, it can. Then is it worth it for me to invest on the workshop? If it's yes, then go. Ask yourself, do you want to learn further? Do you want to dig deeper? I feel technique, I learn it. Yes, I get results. Too complicated. Too complicated. You know? Then I don't like the complicated things. I want to make things simple. I want to make things simple. And I don't like the things that's a very painful one. I know all this. I learn trigger point as well. I don't use it all the time, but sometimes I'll use it. When do I use it? When things are not working well, I combine it. I introduce, I bring some other technique, bring it in and needle it. I needle trigger point as well sometimes. Not all the time. When I use GE, I do it very less. I may needle GE point right now. When things are not getting well, I do GE. Sometimes I start with GE acupuncture. So this I want to share with you. I encourage you to learn it yourself first. If you want to get it right, learn it properly, learn it step by step. Go to workshop. Learn from the real master. And you have to do this. If the master is still there, learn from the first hand. You don't want to learn from the second and third hands. It's when I talk about two scale acupuncture, I don't train it properly in there. I know I've been to the workshop, and I combine two scale acupuncture with Dr. Tan scale acupuncture with Fang star acupuncture. So I combine other scalp acupuncture. So my way of doing acupuncture, I can just give you some information, and it's not the best one. I think it's not the original two scalp acupuncture. If you want to do two scalp acupuncture, then go to Dr. Chu's workshop. This is my best advice. I don't want to lead you to the wrong place. I want to lead you to the right place to learn it properly. Does that make sense to you? All right, we finished today. We finished what is neck pain already. This extra thing to share with you because you asked the question, and I do encourage you to learn more and more. And my promise and commitment is every morning I'm here with you to talk about, to share my experience, talk about disease step by step. Tomorrow we're gonna talk about what causes neck pain. Right? This is our topic for tomorrow. And stay awesome, and I love you all. I'll see you tomorrow morning. Okay, let's end the video.